Welcome to our deep dive, into perioperative nursing care.
Ooh, perioperative.
Yeah, so we're going to be looking at some lecture notes actually from a nursing course that one of our listeners sent in.
Oh, nice.
So this should be very detailed.
Yeah.
And hopefully we can kind of go beyond, the basics and really get into the nitty-gritty of what these nurses do.
Yeah. And I'm really excited to get into this because, people think about the operating room and they think about the surgeons, but the nurses are involved at every single step of the way,
Yeah.
from pre-op to post-op,
Mhm.
and even after the patient goes home.
Yeah. So let's start at the very beginning.
Oh, wow.
Why do people even have surgery?
Right.
I mean, obviously, we think about broken bones or tumors that need to be removed or things like that.
Mm-hmm.
But the notes actually go into some less obvious reasons.
Yeah, sometimes it's about diagnosis. So sometimes you need to do surgery to figure out exactly what's going on.
Right.
Like if you have an x-ray and there's a suspicious shadow,
Oh.
you might need to get in there and do a biopsy and figure out what's really going on.
So like a little detective work.
Exactly.
Yeah.
A little bit of exploration.
Oh, and the notes also mention surgery for prevention.
Right.
So tell me about that.
So think about like removing a mole that has some signs that it might be turning cancerous.
Right.
You
Yeah.
can get that out early and prevent a much bigger problem down the road.
Yeah, that makes sense.
Yeah, prevention is key.
And speaking of urgency, the notes talk about a classification system for surgeries
Oh, yeah.
based on how quickly they need to happen.
Absolutely. It's a 1-to-3 system.
Okay.
And it's really highlighting how crucial these decisions are about timing.
Right.
So, imagine a ruptured aneurysm.
Oh, gosh.
That's a class 1 situation.
Okay.
We got to get in there right now.
Yeah.
And that bumps all other scheduled procedures.
Wow.
So that's the most urgent, emergent kind of situation.
So class 1 is like the surgical SWAT team.
Yeah,
Yeah.
coming in to save the day.
What about the other classes?
So class 2 is urgent,
Okay.
but not necessarily life-threatening.
Yeah.
Like in that moment.
Okay.
So think about something like an appendectomy.
Right.
It needs to happen pretty quickly,
Yeah.
but it can usually wait a few hours.
Right.
And then class 3 is something that, should be done within a couple of days,
Okay.
but isn't an immediate emergency.
Right.
So that would be like something like
Yeah, makes sense.
a knee replacement or something.
Yeah. Okay. So that system makes a lot of sense.
Yeah.
And kind of highlights, just how urgent and important these decisions are.
Yeah, they're constantly triaging,
Yeah.
trying to figure out who needs to go first.
And speaking of critical decisions, let's talk about consent.
Okay.
It seems kind of obvious that you need a patient's permission before performing surgery,
Hmm.
but the notes actually go into some fascinating details about informed consent.
Yes, informed consent is so important.
Right.
And it's not just about signing a piece of paper. The surgeon is ultimately responsible for getting that informed consent,
Right.
but the nurses play a vital role in making sure that the patient really understands what they're agreeing to.
So the notes break down informed consent into 3 main parts.
Mm-hmm.
First, the patient needs to understand what to expect if they have the surgery, so both the potential benefits and the risks.
Exactly.
Then they also need to understand what could happen if they choose not to have the surgery.
Right, where are the consequences of delaying or saying no to that procedure.
So it's like weighing the pros and cons
Right.
of each path.
Exactly.
And then the third part of informed consent is making sure that the patient is actually capable of making that decision
Right.
in the first place.
So they need to be of sound mind and not, under the influence of medication that might impair their judgment.
Right.
But things can get really tricky in those emergency situations.
Like if a patient, comes in unconscious after an accident.
Exactly.
Yeah.
So in those cases, the doctor can actually do life-saving surgery without that explicit consent.
Right.
But then they need to get consent from a proxy, like a family member,
Right.
as soon as possible.
So it's like this balance between,
Yeah.
acting to save someone's life, but
Yeah.
also respecting their
Autonomy.
autonomy. Exactly.
It's a tough situation.
So much responsibility on the shoulders of the medical team.
Yeah.
Okay, so let's say a patient has decided to have surgery,
Okay.
and they're scheduled for the procedure.
Hmm.
What happens next?
So pre-op.
Pre-op.
Pre-op is a really important time, and it's not just about the physical prep.
Okay.
The notes emphasize the importance of psychosocial assessment.
Oh, so it's not just like checking their vitals and
Right.
making sure they haven't eaten.
Exactly. It's
Okay.
about digging deeper and really exploring the meaning of the surgery to the patient.
Okay.
What are their anxieties,
Yeah.
their fears,
Are they worried about
body?
body image changes after the procedure.
Yeah, you really want to understand the whole person,
Yeah.
not just their physical condition.
That makes a lot of sense because surgery is such a
Yeah,
major life event
absolutely.
and everyone's going to process it differently.
Yeah.
And then, of course, there's all the medical history to go there.
So previous surgeries, allergies,
Uh-huh.
and then a really detailed medication reconciliation.
Oh, yeah. Tell me about that.
That's where it gets really interesting because you might be surprised at how many people forget to mention supplements or herbal remedies.
Oh, right.
And those can have a big impact on outcomes.
So it's not just about like prescription meds.
No, it's everything.
Okay.
Vitamins, over-the-counter meds,
Wow.
even, recreational drugs.
Gotcha.
Everything goes on the table.
Yeah.
Because certain medications can really affect how a patient responds to anesthesia or how quickly they heal after a surgery.
Yeah, that makes sense.
Yeah.
So it's really important to get that full picture.
The complete picture.
Everything.
That they're taking. Wow. And then there's all the pre-op teaching.
Yes.
Like helping the patient know what to expect.
So pre-op teaching is really about empowering the patient
Okay.
and reducing anxiety. The notes talk about using sensory language to really paint a picture of the whole experience.
Okay.
So what will you see, hear, smell, and feel before, during, and after the surgery?
It's like a little sneak peek.
Yeah, a little preview.
Yeah. Behind the curtain so they're not surprised.
Exactly.
Yeah. And I see the notes also list a bunch of specific instructions,
Yes.
like deep breathing exercises, fasting guidelines, and even what to wear.
Or not to wear
Yeah, or not to wear.
on the day of surgery.
So like what kinds of things?
So things that we might not think about,
Okay.
like nail polish, can actually interfere with monitoring vital signs during surgery.
Really? I had no idea.
Yeah, those little details can make a big difference.
Wow.
Yeah.
So this is why I love these deep dives.
You learn something new every time.
It's fascinating.
Yeah, okay, so let's talk about preventing infections.
Okay.
That's got to be a top priority.
Absolutely. Surgical site infections, or SSIs, are a major concern.
Right.
And the notes actually outline 6 key strategies to prevent them.
Okay.
And these strategies involve everything from, prepping the skin with a very specific antiseptic solution to keeping the patient warm during surgery.
Wow. So one thing I thought was interesting is that they don't shave the surgical area anymore.
Oh, yeah.
I always thought that they did.
Yeah, that's a common misconception.
Yeah.
It actually turns out that shading increases the risk of infection
Oh, wow.
because you're creating these tiny little cuts
Right.
that can harbor bacteria.
Yeah.
So if hair removal is absolutely necessary,
Okay.
they use clippers right before the surgery to minimize that risk.
Wow. So every detail is really carefully considered to make the safest possible environment.
Absolutely.
Yeah. Okay. So we've prepped our patient. They're ready for surgery. What's next?
All right, so let's go into the operating room.
Okay. Paint me a picture.
All right, so the OR is this really fascinating blend of high-tech equipment and highly skilled professionals
Okay.
working together seamlessly.
Okay.
So you've got the surgeon, of course, who's
Okay.
leading the procedure, but then you have the surgical assistant, the scrub nurse, the circulating nurse, and the anesthesiologist,
Right.
each with their own specialized expertise.
Oh.
And they all have to work together perfectly.
Yeah. It sounds like a very carefully choreographed dance.
Exactly.
With everyone playing a critical role.
And at the center of it all is the patient,
Right.
whose well-being is the ultimate goal
That's
of
right.
this whole team.
Speaking of the patient's well-being,
Okay.
let's talk about anesthesia.
Yeah.
I know there are different types.
Yeah.
And they can really profoundly affect the patient's experience.
Absolutely. So you've got general anesthesia,
Okay.
which puts the patient completely
Yeah.
under.
Right.
And then you have local anesthesia, which just numbs a specific area.
Right. And so general anesthesia, I imagine, is used for like longer, more complicated surgeries or when they need the muscles to be relaxed.
Exactly.
Yeah.
And then there's a whole bunch of medications involved.
Right. So tell me about those.
So you have your intravenous induction agents,
Okay.
like propofol,
Okay.
which puts you to sleep really quickly.
And propofol is...
That's the one Michael Jackson called his milk.
Yeah.
This is a very fast-acting anesthetic.
Wow.
And then you have your muscle relaxants
Okay.
to keep the patient still during the surgery.
Mm-hmm.
And then inhalation gases to kind of maintain the anesthesia throughout the procedure.
Okay.
And then, of course, medications to manage pain,
Right.
anxiety, and nausea.
It sounds like a whole...
It's like conducting an orchestra of
Yeah.
medications.
Yeah, and the anesthesiologist is responsible for keeping it all in
Harmony.
perfect harmony.
They're constantly monitoring the patient's vital signs,
Right.
EKG, oxygen levels, everything.
Yeah, to make sure that they're safe.
Yes.
Wow.
It's a big job.
It's amazing how much goes on behind the scenes to make sure that surgery is successful.
Mm.
But what happens when things don't go according to plan?
Oh, right.
What are some potential complications?
Yeah, what are those what ifs
Yeah.
that can happen during surgery? Well, it can be a little nerve-wracking to think about.
Yeah.
But the good news is the surgical team is prepared for pretty much anything.
Right.
They're really well trained to anticipate any potential problems and respond quickly.
So they have systems in place.
Absolutely. Layers and layers of safety built in to minimize those risks.
Like what kinds of things?
So the notes mention something called a surgical pause or a timeout.
Oh, yeah.
That happens right before the surgery actually begins.
Yeah, I've heard of that.
Yeah,
It's like a final check
it is.
to make sure everything is good to go.
Exactly. The whole team stops.
Wow.
They verify the patient's identity, the planned procedure, the surgical site, make sure they have all the equipment and supplies available.
They don't start cutting until they do the timeout.
Until they do that timeout.
It's amazing, all these little details that
Yeah.
can really prevent errors.
Absolutely.
Yeah, it seems like such a simple thing, but it makes a big difference.
Huge difference.
Yeah.
When you think about all the potential complications we've been talking about,
Right.
it really highlights how important those safety checks are.
Okay, so let's shift gears a little bit and talk about pain management.
Correct?
We touched on PCA earlier.
Yeah, patient-controlled analgesia.
Right. But the notes also mentioned epidural analgesia
Oh, yeah.
as another option for pain relief after surgery.
Epidurals are fantastic.
Yeah.
Especially for managing pain after like major surgeries,
Okay.
especially in the abdomen or the chest.
And the benefit of that is...
So patients have much better pain control,
Okay.
which means they can move around sooner,
Right.
which helps with recovery.
It all kind of...
It's all connected.
Yeah, it all works together. So how does an epidural even work?
Okay, so imagine the epidural space as like a tunnel surrounding your spinal cord.
Okay.
Okay, so a thin catheter is placed in that space,
Okay.
and pain medication is delivered continuously through that catheter.
So it's like a constant drip of
yeah.
pain relief
Right to the source.
directly to the source.
Mhm. And because it's delivered right to those nerves,
Okay.
it can provide really excellent pain control with fewer side effects.
Than like a traditional IV pain med.
Exactly.
Yeah, and the notes mention several advantages.
Yeah.
Like less sedation and even improved lung function.
Because patients are more comfortable,
Right.
they're able to take deeper breaths and cough more effectively.
No, that makes sense.
So it helps prevent those respiratory complications we were talking about.
It seems like a win-win.
It is a really great option for a lot of patients.
But are there any downsides or risks to this?
Yeah. So like any medical procedure, there are some potential complications. One of the risks is bleeding at the epidural site,
Okay.
which can be serious, but it's very rare,
Okay.
especially with experienced anesthesiologists.
Right, and that's where the nurses come in.
Exactly.
To watch for any signs of problems.
They are constantly monitoring,
Yeah.
looking for any signs of bleeding, swelling, or infection
So they're checking the site?
regularly.
Yeah.
And of course, they're monitoring vital signs, pain levels,
All that good stuff.
all that good stuff. And they even use a special scale called the Bronage scale
Okay.
to assess the patient's motor response in their legs after an epidural.
So they're checking to make sure the medication isn't causing any weakness?
Exactly, making sure everything is working as it should.
Okay, so it sounds like they're constantly analyzing
Always.
all these details to make sure the patient is safe.
Yes, nurses are like detectives,
Yeah,
constantly looking for clues and putting the pieces together.
I like that analogy.
Yeah.
Okay, so we've talked about respiratory complications, cardiovascular complications, but the notes mention a whole bunch of other things.
There's so many things that can happen.
Yeah, so tell me what else we need to be aware of.
All right, so we've got temperature changes, skin and wound complications,
Okay.
and even psychosocial challenges
Oh, wow.
like anxiety, body image disturbances.
So it seems like the whole body
The whole body.
goes through an adjustment
Yeah.
after surgery.
It's a major system reboot,
Yeah.
and nurses have to be prepared to address all of those things.
So let's start with temperature changes.
Okay.
What's normal and what's not normal?
Okay, so in the first 12 hours after surgery,
Okay.
a low body temperature or hypothermia is actually quite common.
Oh, really?
Yeah.
Why is that?
It's often due to the effects of anesthesia
Okay.
and just the loss of body heat during the surgery.
So they need to be kept warm.
Yes, warm blankets, warm IV fluids,
Right.
anything to kind of bring that temperature back up.
Okay, but then I see here it says that a fever is possible. in the first 24 to 48 hours.
So it seems a little contradictory. But a mild fever within the first couple of days is usually just the body's natural inflammatory response.
Okay.
It's a normal part of healing.
Okay.
But a fever that develops after the third day could be a sign of infection.
Okay, so that's when the alarm bells go off.
Exactly.
Yeah.
That's when nurses need to be extra vigilant, looking for any signs of wound infections,
Right.
urinary tract infections, respiratory infections.
Temperature is a key indicator
It is.
of how the body is recovering.
Absolutely. And they use that information along with a ton of other assessments
Right.
to really guide their care.
Okay, let's move on to integumentary complications,
Right.
which basically means anything related to the skin and the surgical wound.
Right. So the most common one we think about is a surgical site infection,
Right, an SSI.
an SSI. And we talked about preventing them earlier, but what are the signs that one has actually developed?
Yeah, so what should patients be looking out for?
Okay, so the classic signs are redness, swelling, warmth, pain, and maybe some pus or drainage from the incision.
Oh,
Yeah. And like we just talked about, a fever could also be a sign.
Okay, and so if a nurse sees any of those signs,
They're calling the doctor
right away.
immediately.
Yeah.
Early detection and treatment is key.
And what does that treatment usually involve?
So it depends on how bad the infection is,
Okay.
but usually the doctor will order antibiotics.
Okay.
And sometimes the wound might need to be opened and cleaned.
Oh, gosh.
Yeah, not very fun,
Ugh.
but sometimes it's necessary.
And what about those surgical drains we talked about earlier?
yes.
Those need special care, too.
Oh, absolutely. They are a common way to remove excess fluid or blood
Right.
from the surgical site
But they can also be an entry point.
for bacteria.
Right.
So nurses are responsible for emptying, cleaning, assessing those drains regularly.
So those things are pretty important.
They are.
And it sounds like they require a lot of attention.
Yeah, the notes mention all these specific steps for caring for drains.
Okay.
So it's very meticulous.
Well, I bet
Yeah, nurses have to really carefully monitor the drainage, watching for any changes.
Like what kinds of changes?
So like a sudden increase in drainage,
Okay.
change in color from clear to cloudy or bloody,
Okay.
or a foul odor.
Okay, so they're looking at all these different aspects
Hmm.
of the drainage.
It's like they're analyzing it, like it's a
Whoa.
scientific sample.
Yeah, and so if they see any of those changes,
Red flag.
red flag.
Could report it to the doctor.
Wow. It's amazing how they're constantly looking at these details.
They're trained to see things that we might not even notice.
Right.
Those subtle little clues about how the wound is healing.
Okay, so we've covered a lot of potential physical complications.
Yeah.
What about the psychosocial issues
Oh, right.
that can come up after surgery?
Those are so important.
Yeah.
Because patients might experience this whole roller coaster of emotions
Right.
after surgery.
Yeah, you're dealing with pain,
Or
dealing
with
with
comfort.
discomfort, you know.
Hey, you're not sleeping well.
Yeah. Right. And then like you said, maybe you're dealing with body image changes
Yeah,
after surgery.
absolutely.
Yeah.
Especially after procedures that involve visible scars or alterations to their
Mhm.
appearance.
Right.
So it's a huge adjustment, both physically and emotionally.
Yeah.
So nurses really play a key role in supporting patients through these challenges,
Okay.
just by listening attentively, providing reassurance,
Okay.
and offering some practical advice.
So they're not just medical experts, they're also,
They're counselors.
yeah, counselors.
Yeah, they wear a lot of hats.
And remember we talked about alcohol withdrawal earlier?
Yeah.
That's another potential complication.
Absolutely, especially for patients who regularly drink heavily.
Yeah.
That needs some specialized care.
Right. Because untreated alcohol withdrawal can be very dangerous.
Very dangerous.
Yeah. So the nurses are trained to recognize those signs and symptoms.
Yes, and they know how to intervene appropriately,
Okay.
which might involve medication,
Yeah.
and close observation.
Yeah. It's incredible how much they have to know and be able to.
You know,
They're like medical superheroes
they really are.
with a toolkit for every situation.
Yeah.
Okay, so we've talked about what happens during surgery,
Mhm.
some of those immediate post-op complications.
Yeah.
But before we wrap up this deep dive,
Okay.
we need to talk about that crucial final stage,
Discharge teaching.
discharge teaching. Yes.
Getting patients ready to go home.
Yeah, because recovery doesn't end
No.
when they leave the hospital.
Exactly. It's really just the beginning in a lot of ways.
Yeah.
And so discharge teaching is all about empowering those patients
Okay.
to manage their own care at home
Okay.
and to recognize any potential problems.
So what kinds of things do they cover?
So wound care medication instructions, activity restrictions,
Awesome.
dietary modifications, all that good stuff.
Wow.
They really go over everything and they answer any questions.
And I imagine pain management is a big topic.
Huge. Absolutely.
Yeah.
So they go over how to take their pain medication safely, effectively, and encourage them to use those non-pharmacological methods as well.
Like ice eat.
Relaxation techniques.
Like they're giving them a toolkit.
Yeah, toolkit for managing their pain.
And they also teach them about signs of infection.
Yes.
And when to seek medical attention.
So they emphasize, monitoring the wound, redness, swelling, drainage, increasing pain, all those things.
Okay.
And they give them very clear instructions on when to call the doctor.
So they're sending them home with a roadmap.
Yeah, a roadmap for their recovery.
And I imagine they also connect them with any other support services.
Oh, absolutely.
That they might need at home.
So home healthcare, physical therapy, anything they might need.
Yeah, so it sounds like discharge teaching is that final piece of the puzzle to make sure that they have a smooth transition.
Back to their life.
Back to their everyday life.
Mm-hmm.
Wow, we've covered a lot of ground
Yeah.
in this deep dive.
From the inner workings of the OR
Right.
to the complexities of post-op.
Yeah, and it's amazing how much goes into
Yeah.
making sure a patient has a safe recovery.
And how much those nurses really do.
Yeah, they really are the unsung heroes
Absolutely.
of surgery.
They are advocating for their patients every step of the way.
Yeah, and using their expertise
Yeah.
to make sure the patient has the best possible outcome.
I think what's so remarkable is how much they anticipate potential problems
Yeah.
before they even arise.
Yeah, it's like they're always one step ahead.
Always thinking ahead,
Yeah.
planning for those what ifs.
And it seems like every little intervention can make a difference
Absolutely.
in preventing bigger complications down the road.
Every detail matters.
So perioperative nursing is a very complex
Oh, yeah.
and demanding specialty.
It requires a ton of knowledge,
Yeah.
critical thinking skills,
Yeah,
and a ton of compassion.
definitely.
You got to love what you do
Yeah.
to be a perioperative nurse.
Okay, so I think we've covered pretty much everything
I think so.
for perioperative nursing care.
Yeah, we hit all the major points.
But I do want to talk about a couple things that
Okay.
maybe we didn't emphasize enough.
Right.
Just to kind of round things out.
Okay, sounds good.
Yeah, it is pretty amazing, how every aspect of care kind of connects
Mm-hmm.
and how one intervention can have this ripple effect
Yeah.
on the patient's overall well-being.
It's like all these systems
Yeah.
are intertwined.
And the nurses are kind of the masterminds behind it all.
Yeah, they're like those puppet masters,
Yeah.
making sure everything runs smoothly.
Yeah. We've talked a lot about the physical, aspects of recovery. But, we shouldn't forget about the emotional and psychological impact of surgery.
Oh, absolutely. That's huge.
Yeah.
Surgery can be a very emotional experience.
Right.
Patients have a lot of anxiety and fear even after a successful procedure.
Yeah, I imagine just facing the unknown,
Mm-hmm.
Your body's been through this major ordeal. Yeah.
You're surrounded by all these, unfamiliar sights and sounds and smells.
It's a lot to take in.
Yeah. And then, you might be dealing with physical changes
Yeah.
from the surgery.
Body image is a big one.
Yeah.
Especially for procedures that leave, visible scars or change your appearance.
And it's one thing to know that intellectually,
Right.
okay, I'm going to have a scar.
Yeah.
But it's another thing to actually see it.
Feel it.
Yeah. And have to adjust to that.
It's huge adjustment.
So how do nurses help patients through that?
Well, they just listen.
Okay.
They offer words of encouragement. They normalize those feelings.
Okay.
They let patients know it's okay to be scared,
Right.
anxious, or even sad after surgery.
So it's really about
Holding their hand.
holding their hand through that emotional roller coaster.
Exactly.
And sometimes they might even suggest additional resources
Yeah.
like support groups or counseling.
Absolutely. The patient's really struggling.
They can connect them with specialists who can help.
Yeah, it's all about that holistic approach to care,
Yeah.
addressing not just the physical, but the emotional and psychological.
The whole person.
The whole person, exactly. And, speaking of that holistic approach,
Yes.
we talked about alcohol withdrawal earlier. That's something that nurses really have to be on top of.
It's a big one
Yeah.
because, like we said, untreated alcohol withdrawal can be very dangerous.
Very dangerous. And sometimes people don't even realize
Right.
that they're physically dependent.
You might not even think about it.
Yeah. So what are some of those signs and symptoms that nurses are watching for?
So it can range from mild anxiety,
Okay.
tremors,
Okay.
to more severe things like seizures and hallucinations.
Oh, wow.
Yeah, it can get pretty serious.
So they have to be able to recognize those early signs.
Yes.
And know how to intervene.
Exactly. And there's a specific protocol they use.
Right. We talked about the CIWA.
Yes, the Clinical Institute Withdrawal Assessment.
And that helps them assess how severe the withdrawal is.
Mm-hmm. And make sure they're giving the right treatment.
So they're not just relying on their gut feeling.
No, they're using an objective measure
Yeah.
to make those decisions.
It's incredible, just how much knowledge and skill goes into this.
They have to know so much.
Yeah, they're like medical detectives,
Yeah.
always analyzing clues, anticipating problems.
Getting ahead.
And then, jumping in to fix things.
Yes, always on their toes.
Wow. So we've covered a lot in this deep dive.
We have.
From, that initial decision to have surgery all the way through, recovery at home.
The whole journey.
And I think we both have a newfound appreciation for these perioperative nurses.
They are amazing.
They really are the unsung heroes.
Behind the scenes, making it all happen.
Yeah, working tirelessly to make sure patients get the best possible care.
Absolutely.
So to all the perioperative nurses out there,
yes.
Thank you.
Thank you for everything you do.
For your hard work.
Yeah.
Your dedication.
Your compassion.
For your expertise.
You're making a real difference.
And to anyone listening who's facing surgery, you don't be afraid.
You're in good hands.
Yeah, you're in good hands.
There's a whole team of nurses who are there to support you.
Yeah, so, take comfort in that.
Yeah.
Remember everything we've learned.
And ask questions.
Yeah, ask questions.
Be an advocate for yourself.
Advocate for yourself.
Or your loved ones.
Yeah, well, thank you for joining us on this deep dive into the world of perioperative nursing care.
Yes, this was a fascinating one.
It was, and we'll see you next time.
For another deep dive.
Into another fascinating topic.